Hi, everyone. Seth here with Dr. Bruce Phillips. I just wanted to take some time and really go through a couple of questions with Dr. Phillips regarding how he got into chiropractic. So thank you for joining us today.
My
And
pleasure.
yes, Dr. Phillips, if you don't mind, do you have a story of how you actually got involved with chiropractic?
I do. I'll try to give you the Cliff Notes version
Please.
because it can get lengthy. But I was
Sure.
at Butler University and I was pre-dentistry. I was going to be a dentist.
Oh,
And
wow.
I was a scholarship track athlete there. And I guess in hindsight, I can say this, but I guess because of all the stress and everything, I was getting some significant adrenal fatigue, but I didn't know that
Yeah.
to the point where I was getting blacking out and the spots in front of the eyes, all those consistent symptoms. And I was kind of wigging out about it at the time, only being, I think I was 18 or 19. And so I talked to my academic advisor. He suggested I go get checked out. I mean, you name it, I had the test and it was all normal. And uh, just so happened I had met what turned out to be my wife, Julie, and her dad was a chiropractor. And so I'd gone through all these tests. Now it's Christmas break, and I told my mom, well, I'm driving to her house and I'm going to visit her for the holidays. And I get up there and all heck breaks loose. I'm vomiting and all
Oh,
these symptoms had come to a head. And he comes to me and he said, do you mind if I check you? And I'm like, absolutely not. Anything would be appreciated. And he starts working on me. And he probably worked on me 2 or 3 times a day for the next 2, 3 days. And not that I had a fever, but the last time that he worked on me for that particular treatment, it was like a fever broke, you had this aura that everything was going to be better, and you're like, holy cow, this is going to come to an end. And of course, at the end, I'm interested in this and I'm asking what he did for me and getting information. And he tells me one of my major symptoms was adrenal fatigue and it was affecting my, all these different organs. And he, of course, had me on supplements after I stopped throwing up. And I said, this is interesting. I'll go this far with the story because it's kind of ironic. I would like to investigate this more. And just so happened next semester at Butler, you had to take a speech class. So I just decided my topic, I mean, you could talk about anything. He was just grading you on speech. And my topic I decided would be chiropractic. And honest, we just wrote our topic on a piece of paper and put it in this bowl, and he collected them just so he'd know everybody's topic and make sure we didn't have a bunch of redundant topics. And this pre-med kid, for whatever reason, decides to talk about the dangers of chiropractic.
oh,
And so it ends up being a little bit of a debate, and he had no information. He equated us to, charlatans and witch doctors and all this type of thing. And I don't know where all this came from at that level, but didn't really know the kid that well. But it was interesting that I got exposed to that right out of the gate.
yeah. You knew what you were in for moving
Yeah.
forward, right?
And so needless to say, I changed, not that it was a big change, but I changed my major from pre-dentistry to pre-chiropractic, and kind of the rest is history.
That's awesome. So you were essentially an elite athlete, got exhaustion to the point that your body couldn't compensate anymore, and chiropractic was able to bring you out of that.
Yeah. To take that one step further, what then became my father-in-law, he came to my, first ever track meet that he attended, and he treated me after every event, and I performed significantly better. So that
Yeah,
really piqued my interest.
that's awesome. And so, just for everyone that's watching, Dr. Bruce Phillips here is continuing to be an elite athlete in my mind. How many miles do you think you ride on a monthly basis or a yearly basis on your bike?
Yearly
Now?
on my bicycle, I average anywhere from 2,500 to 3,500, and probably I could do a lot more, but it's just a time thing.
Yeah, yeah,
I mean,
I
it
know
takes
it's,
time to ride 100 miles on a bike, but uh,
yeah,
um,
that's
but I
that's
enjoy
awesome.
it. It's fun, and I run as well. and work out as well, try to stay fit. And yeah, it's part of my lifestyle. It brings me enjoyment. It's a stress reliever as well.
Yeah, absolutely. And you're not needing adrenal fatigue at the moment.
No.
Supplements probably help with that, I'm guessing.
Yeah, I take
as well.
I take my supplements.
All
Love
right,
standard
cool.
process.
Thank you. So, yeah. So, that's good to know. For your, since you had a dramatic change that you had experienced personally, I know you've had lots of them, but is there one case study that you could share with everybody that that just stands out in your mind that you'd like to share with?
Well, like you say, there are lots after almost 30 years in practice, but one that's kind of interesting that does stand out in my mind is this young girl, and she comes in with her mother, of course. She's a high school girl, and every morning when she wakes up, from the waist down, she's paralyzed. I mean, limp as a noodle.
Yeah.
By the afternoon, she's on the dance team. And,
that's dramatic.
Yeah. And the medical doctors are clueless. Their next recommendation was to do exploratory surgery on her spine. And of course, they're not really wanting somebody to cut their daughter open and just kind of check things out, Yeah. And so, as is often the case, out of desperation, they turn to a chiropractor, but many of my patients had recommended they come see me, so I'm always thankful for that. But they come in here, and I'm evaluating them, and quickly find some imbalances in their autonomic nervous system. And to me, it just all clicked in my brain, and I said, I really think I can help your daughter. And I think they're somewhat doubtful at that point, but I said, let's just give it a shot and see if we can treat her and see how her body responds to that treatment. But it's not often I feel confident about things to this level, but I really feel confident that we can make a huge difference. And I hadn't treated her, I bet 3-4 times. And she always came in the morning before school because I said it would be best if we treated her when she was symptomatic. And she was then going to school that particular day. And the typical event was, she'd get in her wheelchair out of the car. And mom pulls up to the front of the high school, and she looks at her mom and she says, I think I can walk in. And her mom says, really? She said, yeah. And she walks over to the other side of the door, and she said, well, let me brace you just in case. And she opts out of the car and walks in. And then, of course, the next appointment, she walks into our office, and, our jaws drop, of course. And we're like, okay, tell us what's been going on.
Yeah.
And so that was
great.
One of the many pretty dramatic things that have happened. But that was probably kind of not only a dramatic turnaround of events, but also kind of a unique situation where paralyzed in the morning, but
I've never heard that.
Completely functional in the afternoon.
Yeah, I've heard thousands of different cases, and that's unique for sure.
Yeah. So I thought I'd mention that one because it is a unique one. Probably the end to that story that I always like to add is she always thought all my evaluations and, I do some of the muscle testing. She always thought that was weird. And one particular day after she had gotten better, we're checking her out, and I did something, and she said, that's so weird. And I think she said it in a somewhat complimentary way because she was better. But I said, weird is kind of interesting. Wouldn't it be nice if someday it's weird that we cut people open to just kind of check and see if there's something wrong with their nervous system and spine?
Yeah.
As opposed to this, maybe this could be the new normal, and that could be the weird.
Yeah, correct.
Well, I never thought of it that way.
Yeah. Well, that's the thing is, it's this perception in the general public of what chiropractic has the capacity to do, and they're sometimes fed with the misinformation. And someone that even got dramatic results within 3 to 4 treatments of getting out of a wheelchair and not getting back in is still calling it weird. That's weird. That's weird to me. Instead of positioning it as it's the greatest, one of the greatest gifts given to healthcare professionals at all. I think it's just that's why we're doing this. So
Yeah.
thank you for being on today. And,
Oh, my
you know,
pleasure.
yeah. So, just to kind of wrap this up, I wanted to really just to ask one more question. We could spend hours on this, but I'm trying to provide short and concise. Maybe we can have you on again. But, for you to continue practice, you've been doing this for 30 years. Would you say you've got to have some passion behind that practice of seeing patients and getting results? Is there, can you explain that to everyone that's watching?
Well, I'm human. Some days it does get tiring.
Yeah, yeah,
But to me, the passion is, and what fuels the passion is always, there's so many new things being developed in our profession. And there's so many new concepts being added in our profession. There's so many new techniques being added in our profession. And it's just so cool because people can do different ones and still fuel what their hot buttons are. And for me, I love the nutrition.
yep,
And just looking at Standard Process and MediHerb, they each introduced a new product this past month. And, things just always evolve and always change. And we always learn new stuff. And that's so exciting to me. I love to learn. My wife and I, we've always said learning and education is our drug of choice. And it is. It truly is. It just really gets us jazzed and pumped up. And so it's cool to be in a profession that allows you to learn and then to come into practice the next day and apply the new stuff that you learned and added to your tool bag. And it's just like when you buy a new car, then all of a sudden you see a bunch on the road. Well, the same thing. When you learn a new way to evaluate people and learn of a new way to look at them, then all of a sudden, boom, you see all these problems that you've not observed in the past because you learned something new. Then so that drives you to learn the next thing and read the next book. And to me, that cycle is what drives me in daily practice and to help energize me and certainly getting the results. Gosh, that's so gratifying to see people heal. And probably lastly, just the power of the human body to heal itself. And I think traditional medicine has this ego that they heal stuff. And I always tell patients, nobody heals anybody. The body heals itself. And that's all I'm doing is trying to get out of the way of the body's power to heal itself and restore that power in some cases.
yep.
And it's just so miraculous of the body's ability to heal itself.
That's awesome. It's powerful for the body to be able to heal itself, for you to be able to continue to educate yourself and find new ways to ultimately get results. Because that's what it comes down to, is you're continuously educating yourself and expanding your mind and your practice so that way you can get results. Patients get those results, feel it firsthand. And what they're feeling firsthand is their body essentially being able to heal themselves as you being the facilitator. Correct?
Exactly.
Yeah. So that's awesome. I appreciate that.
My pleasure.
Yeah, absolutely. So thank you for being on today. This, I think, was hopefully helpful for some and powerful for others. And I look forward to doing more. So thanks, Dr. Phillips. You have a great day.
You
Everybody
as
out
well.
there, have a great day. Take care.